breaking news from PS 118 Elementary School in San Francisco, California. We've received report of a school-wide meningitis outbreak. We received news that that is a 6-year-old boy who has been diagnosed with bacterial meningitis, and there is up to 30 more kids present with symptoms of bacterial meningitis. We have report that the family of the child diagnosed with the bacterial meningitis has refused to vaccinate their child due to religious affiliations. To learn more about the outbreak, Dr. Oz is here with us to explain what meningitis is. Dr. Oz, please tell us more about what meningitis is.
Alright, well, meningitis is just basically the inflammation of the meninges caused by different things based on the type of meningitis that it is. There are 5 types of meningitis. There's bacterial, fungal, parasitic, viral, and then non-infectious. Based on the medical reports and the child's symptoms, it was determined that the child had bacterial meningitis.
What are the symptoms of the bacterial meningitis that the child presented, and how was it so easily spread to the other students?
Well, bacterial meningitis is caused by many pathogens. Some of them include Haemophilus influenzae, Streptococcus pneumoniae, and Group B Streptococcus. Common causes of this type of meningitis varies per age group. Each age group can be infected by a different pathogen. So, since this child is 6 years old, he was most likely infected by Streptococcus pneumoniae. Symptoms would include sudden onset of fever, stiff neck. Other symptoms may include nausea, vomiting, increased sensitivity to light, and confusion. These symptoms typically develop 3 to 7 days after the initial exposure.
Who else is at risk for developing bacterial meningitis?
Right, so people at any age are at risk for contracting meningitis. 5 things that are risk factors are age, community setting, certain medical conditions, and working with meningitis causing pathogens and traveling. Alright, so in regard to age, infants are at a higher risk for bacterial meningitis than people in other age groups. However, people of any age are still at risk. And then back to community setting, infectious diseases tend to spread more quickly where larger groups of people gather together. So college freshmen living in residence halls and military personnel are at an increased risk for meningococcal meningitis. And then also in regard to other medical conditions, there are certain diseases, medications, and surgical procedures that may weaken the immune system or increase risk of meningitis in other ways. Other things like working with meningitis causing pathogens, microbiologists who are routinely exposed to meningitis causing pathogens are at an increased risk. And then lastly, in regard to travel, travelers to the meningitis belt in sub-Saharan Africa may be at risk for meningococcal meningitis, particularly because it's during the dry season.
This sounds really serious. What part of the body is mainly affected?
So meningitis, like I said previously, is an inflammation of the meninges. These are composed of 3 layers that surround the brain and spinal cord. These include the dura, arachnoid, and pia mater. So between the arachnoid and pia mater, there's cerebrospinal fluid, which nourishes and protects the brain and spinal cord from pathogens and injuries. This bacteria develops in the cerebrospinal fluid and causes the meninges to inflame. Because of the inflammation, the hippocampus is said to be the most vulnerable area and can be affected and has been shown to lead to atrophy in chronic cases of meningitis.
What else in the body is affected by this condition besides the brain?
Because of the swelling in the central nervous system, the whole body is affected by this, and it potentially causes varying long-term effects. Most people recover without any after effects, but some will experience a few persisting symptoms. But not all of the symptoms, depending on the type of severity and meningitis it is, will differ. So some after effects that might occur, as far as the nervous system goes, severe headaches, cognitive issues and seizures, off balance, poor coordination and dizziness. And then as far as sensory goes, hearing loss, ringing in the ears, light sensitivity, eye pain, or possibly vision loss. And as far as skeletal is concerned, joint pain, stiffness, muscle spasms, body aches, and just general weakness.
So how can you diagnose someone with meningitis?
So basically, to determine if the patient does in fact have meningitis, a sample of blood or cerebrospinal fluid will be extracted from the patient and then sent to the lab for testing and to see if there's any bacteria present. So basically, if they find that there is bacteria present, the bacteria will then be grown, which is important in confirming which type of bacteria that is causing the infection is there. So after that, they can determine which type of antibiotics they want to use to fight or help treat the meningitis.
What can be done to prevent being infected with meningitis?
Well, that's a good question. So bacterial meningitis can definitely be treated effectively with antibiotics, but it is important to begin treatment as soon as possible. Appropriate antibiotic treatment of the most common types of bacterial meningitis should reduce the risk of dying from meningitis to below 15%, which is good. Although, the risk still remains higher for certain populations, such as infants or elderly individuals, or even some that are already critically sick. So, the most effective way to protect you and your child against certain types of bacterial meningitis is to complete the recommended vaccine schedule. So there are vaccines for 3 types of bacteria that can cause meningitis. There's Neisseria meningitidis, Streptococcus pneumoniae, and Haemophilus influenza type B. Furthermore, antibiotics may be recommended for close contacts with people with meningococcal meningitis. Antibiotics may also be recommended for the entire family if a family member displays or develops severe HIV infection and there's a high-risk person in the house. This is to decrease the risk of spreading the disease to that person, since they are already at an increased risk for severe disease. Your doctor or local health department will tell you if there's a high-risk person in your house and whether antibiotics are needed. And then adding on to that, maintaining healthy habits like not smoking, avoiding cigarette smoke in general, getting plenty of rest, and not coming into close contact with people who are sick can also help. This is especially important for young infants, the elderly, and people who already have a weakened immune system and have an increased risk for severe disease.